So, good evening, Dr. Babo. Welcome on live. It's very, very nice to see you.
Thank you for having me. I can hear you excellently. Thank you for having me.
Thank you for being on here. So, one of the things that Toby said, I want to pick out, she said that I know that she used some of her experience from back where she's come from, back in Africa. But one of the things that Toby said was that she feels that during that period she was not prepared enough for motherhood. She some of the classes that she was having, most of the things that she feels that she needed were not available. From your expertise knowledge and from you also being in the UK, do you feel that generally as women, like women generally, do you feel that we are prepared enough for the journey motherhood? So talking about the pregnancy period, the delivery, the postnatal, the depression or after delivery, do you feel like we're prepared enough as women? Because I know story, like for myself, before I had my son, we waited for like a few years. So having all that journey, and then eventually my son came, and then after having my son, complications and all that. So do you feel as a doctor, and also I know that your dad also, do you feel that as women, and also as you also as being a man also, do you feel that you're prepared enough, or do you feel that the society were prepared enough when it comes to bringing forth another life or adoption or whatever it is? Do you feel we're prepared enough?
Oh, I think for me that's a definite no. And I'll caveat that by saying you can't prepare for everything, but you should at least know the basics. The saying I like to say is, knowledge is power, but ignorance is bliss. Sometimes it's just easier not to know, because not everyone will get these difficulties. You might get an easy journey. So it does depend on your personality. If you're someone that worry too much, maybe you don't want to know too much. If you're someone that likes to be prepared, then yes, you should be. But yeah, the answer to your question is no, we're not prepared enough, and we need to do more.
So one of the things that you said that stood out to me, you said we're not prepared enough. And also some people might say, oh, I don't want to know too much, I'll be frightened. I think I was one of those kind of people. But some people might like go more in and beyond what the midwife is saying to them and read and do their own research. But do you feel that the NHS or the health settings, do you feel that we as women, as husband, as wife, as a partner, do you feel that we're giving enough information to help us through that journey, like starting the journey of motherhood or you being a father?
Again, I'll say no. But just to add, so with health professionals and health systems, it's usually a one-size-fits-all. It's general treatment, the one that most people will find useful. Now, everyone needs different information depending on their situation. And, we might not be able to give everyone all the care that they need for their situation. But we can put in more systems to make sure that people are aware. I know in the NHS, I suspect it might be GP dependent as well. They do screening for mental health illness, physical health checks as well. For some GPs, there are some perinatal care. They're excellent. Some places will be excellent and others would not be excellent. So I don't think we're great yet in the NHS, but it's not as bad as it can be. I think coming from two communities, I would say, because I'm also from Nigeria, it's not the same, because there's more pressure for health professionals in Nigeria. We usually don't have time to think about mental health. You have 10 women, you're the only doctor. You're not going to be, you just want to save those lives and sadly leave them to deal with the mental health aspect, because that needs more time and care.
And it's true what you said is really, really true, because I remember before I had my son, there are checks that you do I think also it depends on which part of the country that you're in, because resources will be different based on your locality and where you are based in the country. Would you agree with that?
Yes, it's postcode lottery. You want to hope for the best, but you might not be in a place that gives the best.
So what would you say is the kind of support system that is most beneficial for mothers that are experiencing postnatal depression or psychosis?
So I suppose it's important to talk about, just briefly talk about what postnatal depression and postnatal illness are. Can I just give props to Toby for being very, very bold to share a story? Very courageous. Thank you for sharing that. And we need more of this. We need people to be open with their experiences, because we're all going through a lot. And we need to know that we're not alone. That's also helpful. So postnatal depression, I'll start with, is an illness. It's a mental illness. Usually develops within the first 2 to 6 weeks of people giving mothers giving birth. Symptoms are the same for depression. So got low mood, persistent sadness, low mood, loss of interest, no pleasure, feeling low, always tired, no energy. So those are the core symptoms, and the others, like disturbed sleep, poor concentration, low self-confidence, poor or increased appetite. Some people eat too much, some people eat too little. Some people think about hurting themselves seriously, killing themselves. Some people slow down, some are agitated, some people have this guilt, shame, blame, and it's a spectrum, right? There is mild to moderate to severe, so there are different spectrums of this, but that essentially is what it is. And it does happen to 10 to 15% of women. So if you know 10 women, at least one of them would have experienced postpartum depression. That's high. That's so it's very common. Not to confuse postpartum blues, so baby blues, as people say. That also happens, but that happens to 85% of women. So if you know 10 women, 8.5 of them had postnatal blues, and it's similar, though not as persistent or pervasive as depression would be. It's their mood fluctuates. 1 minute they are happy, the other minute they are sad, the other minute they are irritable, they are tearful, they cry without any great provocation, and they can be anxious as well. That happens, and that's more, but usually that gets better within 2 weeks. But if you're still having it after 2 weeks, then it might be more than just postnatal, baby blues. Another more serious one is postpartum psychosis, which thankfully is not as common, but still, high enough for those that get it. It's where people just lose a touch of reality. They could be having beliefs. Some people believe that the devil wants to get their child, so they want to save that child. Some would believe that the devil is the child, the child is the devil. People hear voices, they act in strange ways, their mood fluctuates very rapidly. That develops very acutely as well, and it's quite risky for the child. Up to 4% of children born with postpartum psychosis will sadly lose their life. So I think that's useful to just understand what's just that's the general information, what those terms mean. I'm sorry, what was the question again?
So one of the questions that I was asking, let me just go back to it. Just give me a minute. I really like the fact that you explained the difference between baby blue and postnatal depression, so that people know that they're two different. And you also said about the time when you become diagnosed as postnatal depression. You said between 2 to 6 weeks. Then when your mood has been low, and then you talked about baby blue also. So what I asked was, what kind of support system is most beneficial for a mother experiencing postnatal depression or psychosis?
One thing we need to know, as Toby said, is that sometimes support is there, but it's not what we want. It's not what we need. So there are risk factors that make different people likely to develop, you know, postpartum psychosis, and the support will depend on those risks. So if someone has had depression, for example, you could start preparing them, start having talking therapies, start, measuring their blood level, just making sure that they are well taken care of. Sometimes you could start antidepressants. Other supports for mild and moderate would be exercising, for example, sleeping. You need to sleep. Um, and then having people around. I think the partner is a big part. It's a big part of this. If the partner is not there, then many women with postnatal depression report they're in fights with their partner, they're in conflicts. Some as well. A risk factor for that is some will be in violent relationships. So if you don't have a good partner, so having a partner that is supportive, it's half the battle. And then medical help as well. If things get difficult, you should talk to your doctors. They might put you in touch with professionals that will know what to do. So it's a big word, support. It could be biological, depending on the risk. It could be psychological. Talking therapies are helpful. The social part is a big part. That's family and friends. And sometimes the nature of the illness is that even when you're with friends and family, you still want to be isolated. So they're there, but they're not there.
So from what because you spoke about baby blue, you talk about depression, and you mentioned something so profound now, that the partner being there to support. My question is, what causes postnatal depression? What triggers it? Because as you're talking, one of the stories that came to my mind was my sister-in-law. One of the what triggered it for her, from what we know, I know that before when she had her first child, when she was pregnant, she can't hold anything in. She's constantly nausea. She's like literally on different anti-sickness throughout her pregnancy. She's always having admission. She's always admitted in the hospital. And I remember, like, before she had her second child, she's always anxious when you talk about having another child. She's always anxious about it and don't want to have another child. And when she eventually had other child, that's when all hell broke loose. She didn't want anything to do with the child. She didn't want, like, literally for weeks, she didn't want to, when you give her the child, she doesn't want to look at the child. She doesn't want to hold the child. She became anxious, but eventually, with the medical support and family help, she everything became better. So is there something that triggered postnatal depression or psychosis?
Very good question. There is no consistent, we can't say this is the cause of postpartum depression or postpartum psychosis. However, there are things that you would see in a woman that will make you understand that this person might be more at risk of developing postnatal depression or psychosis. I like to think of things in the biological, psychosocial, and hormonal aspects. So I'll talk about the biological, and that's basically what I mean by that is the physical attributes that could, predispose you to getting an illness. The first one is, sometimes if you have a history of depression or anxiety, you are more likely to develop postpartum depression. For postpartum psychosis, if you have a history of bipolar affective disorder, you have a history of previous psychotic illness like schizophrenia or an acute psychotic illness, you're more likely to develop postpartum psychosis. If people in your family have had postpartum psychosis, you're more likely to develop it. If you have had it in the past, you are more likely to develop it. If you've not had it and maybe you change a partner, there has been studies that suggest that might increase, the risk. So that's biological. With regards the psychosocial aspect, it's more about the family, the partner. So people that have reported not having a supportive partner or supportive environment, or they are fighting with their partner, or their partner is violent towards them, those are, there's a high likelihood of developing postpartum depression in that case.
Okay.
So if partner is helpful, that helps to mitigate that risk. Hormonal as well. I don't want to, I don't want to say who's coming in, but I'm excited about the person, and the person might touch on that other aspect. So, maybe I shouldn't say more than that. The hormonal aspect is there has been studies, I think one was in 2014, that showed that although the levels of estrogen and pregnancy hormones fall after pregnancy, the people with postpartum illnesses are somehow, they have some genes that's sensitive to those, they are more sensitive to the falls. Because trust me, having all those hormones and just losing it all, it's not easy for anyone. So those are the risks. Those are the things that if you see, you would, you can suspect, but there's no sure consistent, if you have this, then you must have this. It's all about risks of developing it.
Thank you so much. So, from what you said that there's no one factor, one size fits all. Everybody is different, and like when it comes to assessment and looking into this, it all boils down to health professionals looking at people individually, treating everyone individually, and not generalizing and thinking, oh, this is how it's treated for this person or is identified for this person, so that's how it's going to be for the other person. So, thank you so much for that. And